Now we can look at mobility testing. The major difference now in this testing is that the patient's arms will not be on the back of their neck, but rather crossed in front of their chest. So if you bring your arms over, and I'll just swing around this way so you can see where I'm going with my hands. We need our arms crossed for this rather than parallel, and my arm position will be between the two arms so that I can push down on the lower arm without directly pressing against the chest, and I can use the other one as a bit of a lever to bring her up into extension. So if we bring her back into this position again. The other thing that is important here is that you maintain these axes and that you don't overflex the superior joints. So for example, in this region I can quite easily simply flex down through the spine, and what I'm palpating for here again is between spinous processes and just feeling that movement at that segment. Like so. As I go lower down though, I need to be a lot more easier on these top joints, and in order to flex these lower joints, what I'll actually do is I'll slump her back like so rather than flex her forwards. So it's a slump back movement, and I'm palpating between the spinous processes in exactly the same movement. So the axis of my treatments are changing as I go down the spine. For extension, my hand position is the same again, palpating between spinous processes as I extend and feeling the spinous processes come closer together. Again though, as we come lower, I really don't want to be swinging her back this way, and so in order to produce the extension at these lower levels, I'll swing her forwards and actually lordoze the level while I palpate the movement of the spinous processes. Rotation. Testing rotation is around a vertical axis. So I don't have to worry about switching my axis. What I do have to be a bit concerned about, again, is not over-rotating the superior segments as I'm testing the lower. So as I do this test, as I come down the spine with rotation, I'll bring this hand down as I move lower down the spine, so that the force of the rotation and it is near the segment that I'm testing. To palpate this movement again, the fingers will be palpating two spinous processes at the same time, and again on the opposite side to the way I'm rotating. So I'll simply rotate around there, through this movement, feeling the motion occurring. And as I say, as I come down lower, the hand wants to come down lower, so that the force of the rotation is confined more and more to those regions. So again, from these tests, we should be able to determine again whether we have a hypomobility or a hypermobility, and whether we're dealing with a symmetrical or an asymmetrical restriction. And from this information, we can then plan the treatment program.